accident in August of 1997. It was a severe accident that changed my life. I was driving, going probably about 40 or 50, and I was stopped behind a bus, and while I was stopped, a lady had hit me from behind. And luckily I didn't hit the bus in front of me, but however, when I was stopped, my jaw was open. I was talking to my sister, so my lower jaw went to the right, my upper jaw went to the left, and I slammed forward. And I started seeing medical attention immediately thereafterwards. It took me 6 months to rebuild my entire back through physio, acupuncture, chiropractors, numerous different doctors, physiotherapy. Started seeing some of the local dentists and TMJ specialists. And after several years of seeing approximately over 35 different caregivers, no one was able to help me until I met Dr. Clayton Chan. I was really happy when I was referred to Dr. Chan. At that point, I had no other alternatives that were even an option. They had offered me two things. One of them was to do surgery, break my jaw, and a 10% chance success of recovering from it, or to do crowns all over my teeth, and I just wasn't interested in that. I was so happy to hear about Dr. Clayton Chan and to have met him. My doctors referred me to him. He brings everything all together. Neuromuscular dentistry, the jaws, the joints, the person as well. He considers everything. He's absolutely. When I first came to see Dr. Chan, we did a whole bunch of measurements and testing to see where my pain was and what was working and what wouldn't work. And through numerous different things, and he has his methodologies, we managed to find the appropriate position for me that helped me to be pain-free. I had numerous pain points. All of it was so tight on both sides. Most of it was on my right. My jaw deviated all the way to the left. I couldn't chew properly. I could barely eat. I lost a ton of weight. He helped me to find that pain-free position to put my jaw back in alignment, and he worked with all the other doctors together. Okay. So I had numerous areas of pain along my cheeks, along the joints here. I had a pulling sensation, like my face was constantly being pulled, numerous headaches. My back and my neck and my shoulders were so tight. It was extremely painful. I couldn't sleep, I couldn't eat, but it's all so better. Throughout all of my investigation to find a pain-free position and find someone who could help me, I actually went through 12 different orthotics until I met Dr. Chan, and then he found the right one for me and worked with me as my teeth adapted, and he constantly adjusted it so that I was comfortable and I could eat again, I could sleep again, and be a person. Dr. Chan also helped me throughout a pregnancy. I was really nervous about how things would happen. I heard lots of rumors how your jaw moves when you're pregnant and things change a lot, and I was really nervous, but Dr. Chan worked with me throughout it all. He was very patient, and I was still continued to be pain-free, and it was great. Yeah, I ended up wearing the orthotic for approximately 3 to 4 years. We took our time doing it. We wanted to make sure that my jaw was stable so that afterwards, eventually, we would wean myself off of the orthotic, and then eventually I'd be able to have my own natural teeth. No surgery, no crowns, nothing else, all natural. One day I woke up, I was pain-free, I was feeling good, and I knew that I had made the right decision to come and see Dr. Clayton Chan, and I have absolutely no regret. Prior to seeing Dr. Chan, I took tons and tons of pain relief medication, muscle relaxants, antidepressants. It was just a ton. It was just a pharmacy, and now I don't take anything. And Dr. Chan worked really closely with me. We spent several hours optimizing my bite, working with my orthotic to make sure it was absolutely precise. He was very, very patient and made sure that my jaw was stable with my orthotic, that I didn't have pain. It was fantastic. We used numerous different things to measure the success and the timing of where I was at as we were progressing. We did a constant tensing, we used the K7 machine, numerous x-rays to measure us periodically to make sure we were getting to the point of pain-free. After I was stable, we then moved from the orthotic to braces, and it wasn't just typical orthodontics, it was different. Just like Dr. Chan does everything different. He takes into consideration the TMJ, the joint, the muscles, and everything involved, all the physiology. So it wasn't traditional braces. We slowly moved, cut apart the orthotic as required, and then did braces as I was stable. We did slowly and gradually to make sure it continued to be stable and it continued to be pain-free. Initially I was a bit reluctant and I wasn't sure how it was going to work out, but it was perfect. And now I have my braces off, and it's been 3 years later, and I have my smile back. Okay. And so now I have my braces up,